Namaskar. Sustainable Development Goals 3, Good Health and Wellbeing. Both, you see. In this goal, the medical, the pharmaceutical, the life sciences, the healthcare, the governance experts, and the vice planners of the United Nations and member nations came together to ensure the healthy lives for all and to promote the well-being of all living beings at all the ages on the mother earth by 2030 AD or C, you can say that they have planned. WHO also was part of this. So they feel that everybody should get proper infrastructure, proper facilities for health and well-being. SDG 3 has 13 targets and 28 indicators. In fact, to implement all the SDG is the responsibility of United Nations Sustainable Development Group, that is UN SDG, comprised of several multilateral organizations, multilateral agencies, multilateral institutions like World Health Organization, United Nations International Children's Emergency Fund, that is UNICEF, United Nations Development Program UNDP, United Nations Environment Program UNEP, Food and Agriculture Organizations of India, United Nations FAO, etc. We, many times experts say, what FAO is saying about this? FAO means Food and Agriculture Organizations of United Nations, etc. There are so many other organizations. IMF, World Bank. SDG 3 plans to end the impact of so many points are there. First point is the communicable epidemics of tuberculosis, malaria, and even other pandemics. They want to end, in fact, means United Nations wants to end all these things. Then they also targeted the tropical diseases like dengue fever and all those things. Someone says dengue, somebody says dengue. Okay. Next is the waterborne diseases like cholera also has to be taken care. Okay, because then we have to provide clean water and sanitation facilities. So these are interdependent goals, and we are all interdependent on each other. Pandemic has proved. Then SDG 3 plans to reduce significantly the deaths of children and their mothers by increasing vaccinations and providing timely preventive medicines and healthcare services. Okay, so that children should not die at younger ages. That is more important thing, and their mother also should be able to take care of them by protecting herself as well, because elders have to protect themselves, then only youngers can be taken care. Okay, that is a very important point. SDG 3 has a plan to reduce the road accidents by alerting people about the safe driving. They want to reduce the deaths due to accident, road accidents especially. So road safety drives were there, and they will keep happening. Encouraging people to follow all the rules and regulations to reduce environmental pollution and so the health hazards due to that is also part of SDG 3. So environmental pollution has to be reduced. While leaving the room, you should switch off the light. While drink a glass of water, wash it and clean it and keep it there. Or if the plastic glass is taken, wash it, keep it with you, or throw it into the proper places where the plastic has to be, recycling plastic has to be there. Such measures we have to take properly. SDG 3 plans to prevent the non-communicable diseases. Those are causing almost 71%, that is 41 million untimely deaths globally due to heart and lung diseases, diabetes, cancers, etc. By increasing awareness about substance abuse and consumption of overdose of alcohols, drugs, use of excessive tobacco, and also to reduce the deaths caused due to the less physical activities and unhealthy diet and unhealthy practices. So it is nowadays these kinds of diseases are increasing because people are sitting 8 hours in the office. There is no physical exercise. There are people who are working very hard, not taking rest. There are people consuming a lot of alcohol and tobaccos. It is mentioned over here. So spreading awareness is also very important, and helping them getting rid of those bad habits is also very important. That is what is mentioned here. May God bless them so that they can come on the proper path in life. It could happen to anyone, please remember. Now, to achieve SDG 3 globally, more than 18 million health workers are needed to achieve universal health coverage, UHC, universal health coverage, at all the fronts and to reach at grassroots level. So, a lot of job opportunities are there. Only thing needed is will to implement. Okay. Though gaps were there, the United Nations tried to achieve SDG, and all the nations were progressing very well on several fronts before the pandemic. But pandemic has a lot of impact nowadays. What was the impact of pandemic? First point is, as per the United Nations, due to pandemic, almost 23 million children didn't get the essential vaccinations in 2020. As pandemic was there, all the healthcare were diverted on that side. So vaccination was not proper. Next is, there were deaths of almost 1,15,500, means 115,500 deaths of for healthcare workers globally happened because of pandemic. Doctors, paramedics, nurses, they died because of this. May God bless them, because they tried to keep humanity survive. They help in fact. So may their uh, soul rest in peace. They tried their level best. Then pandemic affected 500 million people globally, leading to 15 million deaths. Okay, means 50 crore people were affected, and 1.5 crore people died. Other diseases got less attentions, and one person was suffering from some scratching kind of thing. So a person said, go, what is that you want? He said that, sir, this is there, you take that medicine, please leave the queue. I mean, this has also happened. Other diseases got less attention and disrupted the healthcare services in almost 175 nations. There were doctors who got expert in pandemic, but other diseases like common cold and those things, you take those medicines, please avoid coming here, you might get affected. Such things also happened, and it disrupted the healthcare services in almost 175 nations. That is too much. The impact of pandemic is so alarming that only 40% of the global population will get essential health and healthcare services and a universal health coverage by 2030. So that is the impact. Hence, United Nations is trying to redefine the targets and deadlines as well for achieving SDG. Obviously, now how can common citizen contribute to achieve SDG? United Nations has suggested that all the citizens have to increase awareness about SDG and universal health coverage, and hold their own national government and local leaders accountable, responsible for providing quality, safe, effective healthcare facilities at affordable cost all the times to all, including vaccinations, emergency health services, and recruiting quality human resources for 24 by 7 quality services. That's how we can have the impact on these common citizens. I hope we can contribute at least on this front as the responsible global citizens. Okay, this was about SDG 3 in most lucid format. Thank you very much.